I'm back with another stenosis video, and this time I have Dr. Denise Shostek with me, who is a DC, a doctor of chiropractic, and also, I would say, a professional in homeopathy. Is that how you say it? Practitioner?
Yes.
Of homeopathy. Hi, I'm GloryB, and this is GloryB-TV, a lifestyle channel for mature women who want to look fabulous, feel amazing, and age gracefully. Well, this topic is also important to men, and I have been giving out an article by a different doctor that Dr. Shostek gave me several years ago when I had spinal stenosis, foraminal spinal stenosis in the lumbar spine. And at first I read it and I thought, homeopathy. It's by Dr. Debra Katchen. But I've given it out to hundreds of people since then. But recently, as I'm making this video, it's now available on my website. And so if you're interested in reading it, you'll go into the description box below the video. There's a link right there to go to it, and you can download it, you can print it. And I suggest when you print it out, that you do print it out and that you read it with a pen in your hand and a highlighter, because the article by Dr. Katchen, who, by the way, we believe is retired by now because we can't find her anymore. And she had lived in the U.S. and then she lived in Canada and then
Southern Illinois, I think.
Was she in Southern Illinois? Yeah, I don't know. But we don't think she's practicing anymore because we can't find anything about her. And she sent her patients in the past to my videos to get the article. But the article was written for a publication that was for people who are homeopathic practitioners like Dr. Shostek. It wasn't written for people like you and me. However, it is possible to read it and to get through it and to figure out what you need to do. And a lot of people ask me, okay, are you still in pain? No. So I started taking this, was it 2014? I think I was in pain in 2014.
Yes.
Summer 2014.
I remember.
It didn't go away. I went to one of the orthopedic guys at the big orthopedic place I go to. He sent me to my physical therapist, which was great. 6 weeks later, I still wasn't better. And that's when insurance says, okay, you can have an MRI. So the MRI showed foraminal stenosis. And my physical therapist said, yeah, that's what I figured. And I was still in a lot of pain. And in September, October is when you gave me the article.
Yes.
I blew you off for a while. And then you saw me and you said, did you read the article yet? And I'm like, no. So then I read it and I thought, okay, this is very interesting. It's going to cost me at the most $25 for these two products. And they were very easy to take. The thing is that you have to keep in mind, it eats away at bony growth, which when you read the article, you'll see that's what Dr. Katchen's most of her patients had spinal stenosis. So in the spinal column, they had little bony growths inside that could be seen with an MRI, could not be seen with an X-ray. And only one of her patients had a follow-up MRI, but they all got better. And so did I. So by the time I started realizing, I started taking this in October of 2014 diligently. And by February is when I started to get a little bit of relief. March, more relief. April. By May of 2015 is when I didn't have pain anymore. So sometimes I still get some pressure. Like I figured out I can't swim. Because if I swim, I'm arching that lower back and it just messes things up. I don't run anymore. There are a lot of things I don't do. I don't do race walking anymore. So I had to find, with the help of the physical therapist, other sports and things that I could do to help me out, because, I don't want to be sitting around. I can bike. I can do a lot of weight training. We've talked about osteoporosis. I'm doing jumping. So I can do one jump isn't going to hurt me. So I have lots of exercises on videos that are in the description box below the video. But I wondered if you could tell me, because I even asked you, especially for the Hecla Lava, you buy it. It's these little pellets and a little vial. I've never had to repurchase it. And by the way, I had gotten mine at Whole Foods. They don't have it anymore. I've talked to I would pronounce it boiron, but they pronounce it boron. And they said, well, we still sell it. Not sure why it's not in your Whole Foods. But then at Whole Foods, they had this packet, like a brochure of all their little things that come in the little vials, and they didn't have Hecla lava listed. And she's like, but we still have it. So I found it on Amazon. I've got it linked below. If you're in another country, you're going to have to ask a homeopathic practitioner, where can I get this? But the thing is, you don't just down these little pellets. You put 1 pellet in 6 ounces of filtered water. I just use a mason jar or a ball jar. And then you take 1 teaspoon of the liquid in the morning and 1 teaspoon in the evening. So why would 1 little pellet do that? I don't know, but Dr. Shostek,
how does it work?
Yeah.
So homeopathy works on the principle of like treats like. Okay, so Hecla lava, it literally comes from lava from a volcano, and it's hard, just like stenosis is hard, like a rock. And so the like treats the like. So an example of like treats like, if you get an oil stain on your clothes, we put soap on it to get it out. So what is soap made of?
Oh,
oil base.
Oil base.
Yeah, yeah.
Right.
Or if, let's suppose you have some fresh blood that you just got on your white jeans. Quickly, if you put water on there, or even hydrogen peroxide, water and hydrogen peroxide is so similar in molecular structure, it just bursts the red blood cell and gets the red out. So like treats like.
I see.
Yeah. And it's of such a small microscopic size that it is quickly absorbed into the body, because all you need is just a little bit, just to kind of shift your like frequency, they call it, or your energy, because homeopathy is more of like an energy medicine.
Okay.
That's what they call it.
Now, one thing that a few people have pointed out when they've read the article, which was written by Dr. Katchen, there's a sidebar. Okay, but the sidebar wasn't written by Dr. Katchen. The sidebar was written probably by the editor of the magazine. Then they talked about how some form of this lava hurt some animals. Okay, that's not the Hecla lava that's in the little pellets. That's a different thing. I almost wish they hadn't written the sidebar. But I think in their profession, people would have read that and understood what it meant. But regular people like you and me who aren't in that profession read the sidebar and go, what? It hurt animals? Okay, it's a different thing they're writing about, and it wasn't the little Hecla lava pellets. It's different.
Yeah, and those little pellets are so diluted. If the animals were eating lava that came out of a volcano, and they were probably chewing on it, I don't know what the author was referring to, but it would harm an animal. But this is diluted and diluted and diluted over and over again.
Now, speaking of animals, my dog has had a spine issue, and the last time I heard her at the vet said, oh, by now she's probably got some extra bony growths going on in her spine. And I said, I know what to do about that. So, you know, I've got the treatment, but I didn't know how much to give her. You've seen my dog. She's lying right here, taking a nap finally. She's 9 pounds. Yeah. So I reached out through an association. I found some homeopathic veterinarians, and they're all over the United States. But I reached out to about 6 in my area. They all had their websites listed. Of the 6, one of them had her email address listed, and the rest of them had a contact us form. Told them what I was thinking of doing. I've got this article, you know, just wanted to consult with them. Not for free. I was willing to pay them. I just needed to know how much to give my little dog. Not one of them got back to me.
Wow.
So I contacted Dr. Shostek and said, what do you think? And she said, just give her 1/4. So I want to show you the clip of how I give the dog the Hecla lava, because it's not through a teaspoon. I put some into a little dropper bottle, and I marked, first I played with the little dropper bottle, I gotta back up, and marked where a 1/4 teaspoon was with a Sharpie, and the line's still there, so I know what a 1/4 teaspoon is. And I just fill it in there, and I open her mouth, and I stick it in there, and I just don't put it way back because I don't want her to choke on it, but it tastes like water. And then I take the little Calc Fluor 6X little thing, little pill, that we would put under our tongue as a human, and I just put it in her food, and she eats it right up. So her dog sitter a couple months later said, oh gosh, she seems happier or just livelier. And I thought, oh, well, that's good, because maybe she was in a little pain from the bony growth. I don't know. She's not a human, so she can't tell me, but it's not going to hurt her. And it's such a little amount. It doesn't cost much, and she's older, and I just thought this would be helpful. Now, some people have asked about consulting with Dr. Shostek. And in the next clip, I'm going to show you how to go to her website to schedule a free 15-minute consultation. So let's go right to that clip. When you come to the website, you can click to schedule an appointment. You can go in the lower right and click contact, or go in the upper right and click schedule now. So I'll go to the same place. Let's start with click here to schedule an appointment. This one opens in a new tab, and then you have to click one of these locations, and then you get a drop down where you click free phone consultation. In there, you can go to a different month by clicking the arrows. Then you can choose a date and choose a time. And once you do that, you click the blue continue button. And after clicking continue, you'll come up with a form that you fill out, and then you click confirm booking. Now, let's try one of the other buttons. Let's click contact. And when you do that, then you click a schedule now button. You get the same, but in a pop-up, you click one of the locations, even though you're not going to go there in person. Then you click free phone consultation. Then choose your month by clicking one of the arrows, and click one of the dates that are in black. Click one of the times. Then click the blue continue button, and then fill out the form, all the details, and then click confirm booking. Now that you've seen how to sign up for a free consultation, I want Dr. Shostek to tell you, after you fill out that form and click the submit button or confirm booking, what's going to happen after that.
Okay, thanks, Glory. So after you set up the 15-minute phone consult, I will call you, and we will talk for 15 minutes and find out, am I a good match for you? Do I have something that I can offer you with your health? And it's just a simple conversation, and then you can decide if you want to set up an appointment or not. And I do a lot of telemedicine. I take a lot of insurances, and so we can talk about some of those things.
Yeah, because it is hard. I think it's hard to find a good homeopathic practitioner. And over time, some people have found her one way or another, even though I didn't necessarily on the stenosis talk about, maybe I had your website, but anyway, now we have you here talking about stenosis. I think this is just one of the best kept secrets in homeopathy, and one of the best kept secrets in terms of bony growth in the spine. Nobody knows about this stuff.
And it works.
And it works.
Oh, yeah. I had a 77-year-old patient. When he came to see me, he literally was bent over. He was in so much pain. I thought, wow, I think he really needs surgery. So we ordered the x-rays, the MRI. He had 3 bulging discs. He had spinal canal stenosis, and he had curvature of the lumbar spine. I mean, it was the trifecta that you don't want, okay? So I went with him to this one surgeon over here at Good Sam Hospital, and the doctor looked at everything, and he said, as long as you're walking and you can still talk, he said, I'm not going to do back surgery. He said, I will do back surgery when people are basically almost crawling on the floor and can't even walk. And he said, let's see if you can do some rehab. So I put him on this protocol.
At the same time as like physical therapy.
I gave him the exercises to do for PT. And I gave him some natural anti-inflammatories, and then I did a little insole in his shoe. I lifted up one leg because I watched how he walked, and he was off balance, and that's what's causing the scoliosis. Today, he walks 3 to 5 miles a day, and on the days that he's not walking 3 to 5 miles, he's biking 3 to 5 miles a day. He goes to the gym every day, and now he's like 78, 79. Wow. So this stuff works.
Yeah. So from the time you gave him the stenosis protocol and the exercises till the time he could definitely say he was out of pain was about how many months?
I would say it was we didn't see a change till, we saw a slight change after 30 days. After 60 days, I would say he was more than 50% better. At 90 days, he was back walking. He says, look at all the exercises I can do.
That's pretty fast.
That's pretty good.
Because most of Dr. Katchen's patients and I were 6 months. And I tell people, give this a minimum of 6 months before you decide if it's working or not. I took it for a little longer because I was afraid if I stopped taking it, it would go back, but it didn't. And eventually I just stopped using it, which in the article you read about, some of her patients, Dr. Katchen's patients, just stopped they forgot to take it because they weren't in pain anymore.
That's great.
So this is just awesome. I'll have all the products linked below. So I know a lot of you don't know how to open the description box, especially if you're using a phone or other mobile device. So if you're doing that on a phone, you go below the video, there's a little V. You tap the little V, that opens the description box, and then you can scroll through and find the links. If you're watching on a computer, go below the video on the left side, you'll see the word show more. Click show more. That opens up the description box. So thank you so much for watching. Check out one of my other videos by tapping its image on the right side of your screen, and I'll see you in the next video.